My name's Dr. Melvin. I'm one of the pediatricians at our Denton Health Center, and I am here to talk about RSV today. I'm sure you've heard a lot about it. It's been in the news lately, and I feel like everywhere I turn, I'm hearing about it in my personal life and also here at work. So I want to answer some of the common questions about RSV. The first question you might have is, what is RSV? If you're hearing a lot about it, it's a respiratory virus that causes a bad cold in younger kids. Historically, we've worried more about kids under age 2 and especially under 6 months old landing in the hospital with RSV. But this year, we've seen even older kids, like 4 and 5-year-olds, that have had to be hospitalized with RSV. It's different than a regular cold because kids with RSV have more trouble breathing. You'll notice things like pulling in and out of their ribs. They might be breathing really quickly. They'll probably have noisy breathing. You might hear wheezing. And they're so congested and snotty that they have a hard time eating. So we worry about hydration too, to make sure that they're drinking enough formula or breast milk, or Pedialyte is something you could offer too for babies under age 1. Questions about when you should see the doctor. If you feel like it's more than just a regular cold, lots of kids get snotty noses and they do fine. They're active, they're playing, they're eating and drinking, and that's not too much to worry about. But if you notice that your child is having trouble breathing, they're breathing really fast, you see their belly moving in and out, pulling between the ribs as they take their breaths, it sort of sucks in between the ribs, up at their collarbones, sometimes their nostrils flare in and out, head bobbing, where they're moving their head like this with every breath. Any signs of respiratory distress like that, we want to see you in the office, or if you're really worried, you should go to the emergency room. The other thing would be if they're dehydrated. So if they're not drinking enough to make 3 wet diapers in 24 hours, then you should bring them in to be seen. Most children do fine with RSV. The vast majority of kids are going to do fine at home. You can treat them at home with supportive care. There's no medicine that's going to take RSV away. It's just time. Their body will fight the infection. Things that we can do to support them are nasal saline, suctioning, steam showers where you take them into the bathroom, close the door, turn the shower on as hot as it'll go, and let them breathe in the vapor to help moisten their airways and loosen some of the congestion. Kids over age 1, you can give honey, but there's no good cough medicine, decongestant, or antibiotic that's going to help with RSV. So just push lots of fluids, Tylenol and Motrin if they seem fussy and uncomfortable. And most kids will do fine at home with all of that. But if you're doing those things at home and you notice the trouble breathing or that they just can't keep up with their fluids, that's when we need to see them or have them go to the hospital. If you have any questions about RSV or any other cold or flu infections, feel free to reach out to your Choptank provider. We're happy to answer any questions and help you. I hope you stay healthy and get ready for the holiday season.